Could you speak to something that has to do with maybe a little bit of fear around this type of tracking? And I'll give you a little bit of context. I spoke to I was at a hospital, and this hospital system, um, we were discussing this type of technology and how powerful it is to be able to look at the post analytics, oftentimes referred to as even a grading or some way to see what someone had been doing step by step. And their response was, "Well, we wouldn't want to measure that because we don't want these professionals to fail in these digital sims, right? Like we don't want that stamped." And I kind of understand what they're talking about. So, this wasn't necessarily their situation, but I would extrapolate and say, so if I'm a hospital and I have a Sentinel event, and then I bring in a collection of healthcare providers that were part of that Sentinel event, and so we're going to do some training on that scenario, and so we do some training on it, and the purpose of the remedial training is to just go through it a couple of times and debrief and discuss and then get back on the floor.
I would say a couple of things. Um, Having the ability to measure knowledge, competence, performance, I think there is a lot of power in that for the individual, as well as a lot of assurance for the organization who is providing care to patients. So, a couple of things come to mind for me. In the VR systems that I'm familiar with, the organizations absolutely have the ability to go in and test those with a cohort of employees, nurses, therapists, physicians, whomever, to get a sense of, is the VR asset on point or is it not? Are the questions the right questions? What is kind of the pass rate if we were to deploy this and test it? So the organizations have the ability to do that, to make sure that it is asking the right questions, that the scenarios make sense, that everything in the rooms or in the scenario is recognizable. So organizations have all that control themselves. I think at the end of the day, it is a completely different way to hold individuals accountable for their own practice. That part of it is probably.
I think it was chapter 3, the current state of nursing, from your book. Can you describe for us the current state of nursing, if that includes it being broken? Um, that might be helpful for people out there who aren't in the healthcare profession but find themselves to be patients occasionally.